I'm sure you're seeing on your screens the vaccines as they are being transported from the Emirates aircraft to the VVIP lounge here at the Kotoka International Airport, specifically Terminal 2. And we have a statement from the Ministry of Information regarding the arrival of these vaccines. Thelma might want to read that for us, even as we observe the arrival of the vaccines. 600,000 of them, we have been told. Thelma, what does the ministry say concerning this?
So here's a statement signed by the President's representative at the Ministry of Information, the Honorable Kojopo Nkrumah, and it's a statement on the arrival of the COVID-19 vaccine in Ghana. And I'm going to read this as I received it. It says, the government of Ghana is taking delivery of 600,000 doses of AstraZeneca COVID-19 vaccine made by the Serum Institute of India, Covishield, today, February 24, 2021. This is the first consignment of vaccines acquired through the COVID-19 Vaccine Global Access Facility, COVAX, which Ghana, among 92 countries, has signed on to. COVID-19 vaccination will be conducted in phases among segmented populations. The first segment of the population that will receive from the 600,000 doses will be health workers, adults 60 years and over, people with underlying health conditions, frontline executive, legislature, judiciary, and their related staff, frontline security personnel, some religious leaders, essential workers, teachers, and other personalities in Greater Accra Metro, including Ewutu Senya and Ewutu Senya East in the Central Region. A similar segmented population in Greater Kumasi Metro and Obuasi Municipality will also be covered. From March 2nd, the COVID-19 vaccines will be deployed in health facilities and designated centers in these geographical regions. The government of Ghana remains resolute at ensuring the welfare of all Ghanaians and is making frantic efforts to acquire adequate vaccines to cover the entire population through bilateral and multilateral agencies. We urge you to do your part by ensuring that you get vaccinated when the vaccine gets to you. We acknowledge the hard work of the technical team from the Ghana Health Service, the Ministry of Health, the Ministry of Information, the COVID-19 Task Force, and all those who have assisted in getting us this far. Our development partners are also acknowledged for their tremendous financial and technical support. It is our hope that they will continue to support in our sustained efforts in combating this virus and putting COVID-19 behind us. That's the end of the statement.
And I can hazard a guess as to what informed the choice of those geographical locations. You recall that when there was a lockdown in parts of the country, some of these areas that have been mentioned in the statement actually came up. I mean, were some of the areas that were the hotspots, and so they went under lockdown, partial lockdown. It is therefore not surprising that they have also come up some of the areas to receive the first doses of the vaccine. But the minister designate for health, as well as some government officials, are currently about to receive the vaccines that just arrived. 600,000 doses of these vaccines, and so the good news is that what it means is that at least in the next few weeks, 600,000 Ghanaians, vulnerable Ghanaians and persons who are in front line, essential workers. Do journalists fall within this? If we do,
we would wait for Honorable Kojopo Nkrumah to send a tweet, maybe like he did the last time, and for the avoidance of doubt, journalists are considered frontline workers. So it remains to be seen whether we do get cover up, though. But it's refreshing to note that the Accra and the Greater Kumasi metropolitan areas and Ewutu Senya would be priority focus areas because they have had more cases, and so the attempt to make those areas a priority would be in line.
Which one?
Yes, so it stands to reason, like you said, that these areas should get mention. And as the statement has said, persons with underlying health conditions will also get priority. So at this point, it remains to be seen how that will be determined. I will assume that there has to be some form of medical record that confirms that a person has underlying health conditions. We've been told that persons who are diabetic, persons who have high blood pressure, maybe low blood pressure, people who are asthmatic, and people with other health conditions may be the ones to benefit in that vein. But it remains to be seen how proof of that will be acquired in order to confirm that one indeed is making a legitimate claim to the virus. Because in other countries we've seen instances where people who are deemed as not vulnerable have, been offered the vaccine and they've taken it, and it has led to uproar. Because, for example, those at the front line and those with underlying
very auspicious handing over the vaccines and the
designate. We must remember that until he is confirmed, the minister designates